how the different ECG waves are produced during a cardiac cycle. The P wave is produced as the electrical impulse travels through the atria, causing them to contract. The P wave corresponds to atrial depolarization. The impulse then travels through the atrioventricular node, producing a flat section on the ECG, known as the PR segment. The PR segment is flat because no current is flowing through the cardiac muscle cells. As the impulse travels from the AV node to the bundle of His and along the upper part of the septum, the Q wave is produced. The passage of the electrical signal through the ventricles produces a large spike, called the QRS complex. The QRS complex is much larger than the P wave because the ventricles are much larger than the atria and so produce more electrical activity. Most of the QRS complex represents depolarization of the left ventricle, which has much greater mass than the right. The impulse remains unchanged for a moment, as the ventricles remain depolarized. This gives rise to another flat section, called the ST segment. As the impulse fades away and the ventricles repolarize, the T wave is formed. This animation shows how the different ECG waves are produced during a cardiac cycle.